This portion of Lifestyles is sponsored by Westside Chiropractic.
Dr. Jesse Ignacio here at Westside Chiropractic is going to kind of walk us through what fibromyalgia is, because we do hear people say that so often, but not really sure what it is, because they seem perfectly fine.
Yes, they do. And fibromyalgia is a very, that's like you said, we hear it often. It's a very common term. And actually with new patients, they're like, oh, my doctor told me it's fibromyalgia. So fibromyalgia, what it really is patients will experience multiple tender points, if that makes sense. Not necessarily just on the spine, but throughout the body, usually on the waist up. So they could be like back in through here or in the lower back. And I like to say the easiest way to kind of sum up what I'm trying to explain is that there are multiple like trigger points. Multiple, yes. So fibro is like, it's a hard ball, if you will, and usually it's the muscle tension. So we all know what a trigger point is. A trigger point is that muscle tension, and that's kind of what fibromyalgia is that it's multiple of those points and throughout the back, throughout the body, where patients will experience tenderness. How does it happen? No one's not really sure. But this is something that chiropractic care, along with actual massage therapy, would be very beneficial for that patient.
Well, I think of you aligning spine, keeping my hips in line, etc., but I don't think of you in that way, because it sounds muscular, but is it nerve?
Yes and yes.
Okay.
Because what I mean by that is the spine, like I always say, the nerves come out of each level.
Right.
And those nerves, as we talked about before, go everywhere. They go down the arms, they go down the legs. We know sciatic pain that we've talked about. We even talked about how they go into all the organs. But nerves also go into all the muscle groups. So they go into all the muscle bellies, and they control the function and the movement of those muscles. It's actually nerve innervation that controls the muscle movement. So, of course, we use muscle all day, every day. So that repetitive use and that repetitive motion of all your muscles throughout your body, whenever we do that repetitively, muscle, that's where you get those trigger points that form. And then, like I said, to qualify to have fibromyalgia just means you have multiple of those trigger points throughout the back. So again, tying it back into chiropractic, keeping you nice and adjusted. As we always say, we get you nice and aligned. It keeps that pressure off those nerves, and those nerves, like I just explained, go to the muscle. It calms everything down. But then also the muscle, as well as the massage therapy work, the massage therapy can go in, get those muscles, break up those adhesions, if you will, from those muscles forming that tight ball. And then again, the patient will feel much better, and it relieves the amount of pain, but the adjustments will also help decrease the amount of flare-ups, fibromyalgia flare-ups that a patient will experience.
Because you're staying on top of it, basically.
Absolutely.
And I guess the massage therapist can really feel those places, and the patient's probably going, that's it, you're on it.
And you hear that all the time, and that's what everyone
You're right on it.
Yep, and I do that too. I stretch the person's back out before I adjust, and they're like, how do you know right where to press? And it's because those muscles are just so prominent. So, like I said, the adjustments as well as the massage therapy is a great benefit for that fibromyalgia pain that so many people suffer with. And unfortunately, a lot of times the doctor will say there's nothing we can do for it.
So often we hear that. So there is something you can do. Give them a call, make an appointment. Jessica will assess you, and you can get aligned and get a massage. So a bonus,
Yes, absolutely.
We'll be back with more Lifestyles right after this. Stick around.
This portion of Lifestyles is sponsored by Westside Chiropractic.